To talk to us about what's going on. We have Terri DeWees here this morning from New Hanover Regional Medical Center talking about the emergency room and what actually consists of an emergency. I think anything that happens to anybody they think is an emergency, which is probably the reason why, hundreds of millions of people hit the emergency rooms each and every year.
Absolutely, Bob. According to the CDC, over 136 million people went to the emergency department across the country, obviously.
2 of those were actual emergencies?
No, actually, we see a lot more emergencies than people would think. You know, we've kind of gotten a bad rap over the years about, people are using the emergency departments unnecessarily. That's not true. Our consumers, our patients are very smart, and they know whether they need to be in an emergency department or not.
What actually constitutes an emergency? If you're home and you've got a stuffed up nose, you're not going to the ER, but if you're in the yard and you cut yourself significantly,
then the ED is the place to go. Severe lacerations, chest pain, shortness of breath, any stroke symptoms, so dizziness, difficulty speaking, weakness, severe nausea and vomiting that you cannot get under control, obviously broken bones, and sometimes you just feel so sick that you cannot wait to get into your private physician or to an urgent care.
And as far as getting there, so if when do you make the decision, I need the ambulance? I can't drive myself there. Is that, obviously the ambulance is going to take you to the ER, but is that when time is of the essence?
Absolutely, and the things that we always tell people to call 911 for: chest pain, stroke symptoms, severe injuries. If you feel so bad that you don't feel safe driving, call 911. That's what they're there for.
And you have branched out. We're talking a year now. You got the Northern Complex is a bit of an anniversary for you this year.
Yes, sir. Tomorrow is our first anniversary at ED North. We've exceeded expectations, I like to say. We've had the privilege of caring for over 20,000 patients our first year in operation. Our Health and Diagnostics Center has done over 6,000 CAT scans, almost 3,000 mammograms. It's been a great opportunity for New Hanover, and it's been wonderful to be able to serve the community in the way we are serving.
It was something that was sorely needed in that part of the county. I appreciate the time this morning. Again,
thanks.
We always say if you have any kind of medical issue, you don't call us at the news station. Always call 911 or contact your doctor. We're back after this.